More than 100 million people in the United States have diabetes or pre-diabetes, and many report frustration despite their physician's best efforts. For those struggling with type 2 diabetes or pre-diabetes, today we are discussing a new approach to reversing diabetes with Dr. Steph and Tom Chaney from Living Health Integrative Medicine. They're here to discuss a breakthrough approach to diabetes that's really changing lives. Welcome back to the both of you. And Dr. Steph, I want to start with you because doctors prescribe pills, they say go on a diet, they say exercise, but there's still so much frustration. Where's all this frustration coming from?
Well, it starts really on the first day they get diagnosed. Most of the diabetics that we see, they went in for a routine checkup on one of their annual visits and were very surprised to get the news that they were type 2 diabetic. And they maybe had gone in with a whole different bag of symptoms, seemingly unrelated. And often the first line of treatment or recommendation at that point is a prescription medication. And so off they go. They're maybe told to change their diet. They're not told how. They're told to lose weight. They're not told how. And over time, whether it's months or years, the symptoms pile on, the sugars keep going up, and more medications come down the pike. And eventually they're on diabetes medication, cholesterol lowering medication, blood pressure medication, medication to deal with the side effects. And they're
a table full of bottles.
And the disease is continuing to progress and they feel worse. They're not sleeping. They're not, they're just not feeling great. The weight keeps piling on even though they're trying to lose weight. It's super, super frustrating for people and they don't know where to go because where else can you go?
Well, and we all know, as any of us have done, whether we're trying to eat better or lose weight or get in shape, if you don't see those results after several weeks, you almost want to kind of give up. Yeah. So, Dr. Tom, you guys have a new approach to help people that are dealing with these frustrations.
So when we have a patient that comes in, the first thing we do is we treat them as an individual. And we don't say, okay, you're diabetic, and this is the cookie cutter approach that we use. We know that each individual is unique. They may have high sugars, and that's what they have in common in the diabetic realm, but what's causing those high sugars is different from person to person. Now, a lot of diabetics, they go in and they ask their doctor, well, why am I diabetic? A lot of times they're told, well, it's your pancreas. And what we see, that's rarely the case. There's all these other dysfunctions in the body that are actually causing the disease process. So that's what we go after. We go after these causes.
Yeah, because some of the your patients that we've talked to in the past, with the tests that you do, there's certain foods that are affecting them that not necessarily they're allergic to, right? That's not the word, but
intolerant.
It's just they're intolerant to, and they never would have known that.
Yeah, they could have inflammation to foods, they could have underlying infections, hormone imbalances, other glandular dysfunctions, they could be reacting to other medications or chemicals, herbicides and pesticides and diet products are chemicals that actually contribute to diabetes. So we haven't even talked about the pancreas.
Right. So what are the results that you all are seeing?
Well, we effectively see complete reversals and remissions of type 2 diabetes. And so what we find is that when you look at the numbers with the lab work, the hemoglobin A1C, the sugars, the diabetes markers are all slowly coming down on our protocols. And each person at some point is often able to work with their prescribing doctor to reduce and very often completely eliminate their medications, the diabetes medications, the insulin, the cholesterol, and the blood pressure pills. And so essentially we're able to actually get them into full type 2 diabetes remission.
So no more of, I just have to manage this. This is, you're reversing it.
Right. Most of the drugs out there, they're designed to manage the disease or manage symptoms and the disease process. And what it does is it ignores all of the underlying causes. So if you're ignoring the causes, they're just getting worse over time, and it's creating more and more dysfunction in the body. So we go in there and actually address all those underlying causes and get the body functioning better and get the person healthier.
So Dr. Tom, how does somebody get started with this then? Where do they start?
So you start by coming to our seminar. So we have an educational seminar that we give. So we've got one coming up this Saturday. We've got one next Wednesday. And that's the first step to reversing type 2 diabetes, because that's what we're talking about here. Not managing it, not controlling it, actually reversing diabetes, reducing and eliminating medications.
And you have a big goal that you guys are after, right?
That's right. We want to help at least 1 million people reverse this disease. So that's our goal. That's our mission. That's one of the reasons why we wrote this book, Defeat Diabetes. And everyone that comes to our seminar will get a copy of this book for free for these upcoming seminars.
So if you're interested, I mean, it's easy. The seminars are free to go to. They usually feed you. So get there, get free food, and get some great information about improving your diabetes and reversing your diabetes. Dr. Steph and Tom, thanks so much for being here. The solution to your suffering, really just a phone call away. If you would like to see if you qualify for the Type 2 Diabetes Solution Seminar this Saturday in Columbia or next Wednesday in Annapolis, please call 888-514-4771 or visit diabetesreversalseminar.com. If you qualify, you will receive an invitation to one of the next 2 Type 2 Diabetes Solution Seminars and the free book, Defeat Diabetes. So don't delay on this now. Make the call, 888-514-4771 or visit diabetesreversalseminar.com.